Children are our most precious of possessions. The anguish and trauma of losing one's child is irreparable. Collapse amongst children is uncommon. Yet, when it does occur, it is usually injury or disease that causes breathing to fail first, which then develops into cardiac arrest.
Oh, yeah. Oh, there's somebody found. Oh, where? There.
In instances when child CPR may be required, if the rescuer is alone, 1 minute of CPR should be given before the lone rescuer pauses to call for an ambulance. If a second person is around, he should call for emergency help.
Call ambulance, then I find.
Okay, I go and call.
As in adult CPR, the ABCs of CPR apply. Keep the airway open, give rescue breaths and chest compressions to encourage circulation. Keeping the airway open and giving enough ventilations are the very important initial aspects of child CPR. In cases of suspected head or neck injuries, avoid moving the head excessively. Check for breathing by looking for the rise and fall of the chest, listening for the sound of exhaled air, and feeling the breath against your cheek. Perform ventilation straight away if the victim is not breathing. Take a breath and make a seal with the mouth. Pinch his nose. Give a breath of about 1 to 1.5 seconds duration. Repeat immediately. The correct volume of air is the volume that causes the chest to rise. Next, check the neck pulse. If there is still no pulse, start chest compressions. With your middle finger, find the notch where the ribs meet the lowest part of the breastbone. Place your index finger down. Place the heel of your other hand next to this finger. Begin compressions. The depth of compression should be 3 centimeters. After every 5 compressions, give a ventilation. Use one hand to maintain a head tilt chin lift to ensure that the airway is kept open. If you are alone, you should call for emergency help after about 1 minute or 20 cycles of CPR have elapsed. Continue until the pulse returns or ambulance crew arrive. Remember to keep checking every few minutes. If pulse returns, check for breathing.
Okay, come. Okay. Yen, do not like that. You choke on your foot.
The Heimlich maneuver should only be used when it becomes obvious that the victim's airway is becoming completely obstructed.
Yen, are you okay? Are you choking?
Hold the child from behind with your arms around his torso. Place the thumb side of your fist against the child's abdomen, just above his navel. Give a series of distinct upward thrusts. These thrusts generate an artificial cough, which may force the foreign object out. If the child loses consciousness, lay him down flat. Open the airway using a tongue jaw lift and look into the mouth for the foreign object. Remove any visible foreign object with a finger sweep. Never perform a finger sweep blindly. That is, if you cannot see the foreign object, you risk pushing the offending material further back into the throat. Open the airway and attempt to ventilate. If the chest does not rise, reposition the head and attempt to ventilate again. If the chest still does not rise, continue with a sequence of 5 abdominal thrusts and a finger sweep and attempt ventilations. Repeat until the victim is breathing or help arrives.
4, 5.
After 1 minute of CPR and every few minutes thereafter,
Pulse.
check for pulse.
Pulse present. Check for breathing
If
again.
pulse is present, continue with rescue breathing. Rescue breathing is similar to ventilation.
And feel.
Do a head tilt chin lift to open the victim's airway.
Rescue breathing.
Take a breath, pinch the victim's nose and make a mouth-to-mouth seal.
3,000.
Give a breath of 1.5 to 3 seconds. Release the nose to let the victim exhale. Make sure you see the chest rise and then fall. Deliver one rescue breath every 3 seconds.
3,000.
To keep track, count.
2,000. 3,000. 2,000. 3,000.
After 1 minute or 12 cycles, check for breathing again.